Welcome to our presentation on employee turnover in medical practice management, presented by Group 2. Today we will explore why turnover is a major issue in healthcare, the main factors driving it, and the practical strategies that organizations can use to improve retention. We will also highlight key benchmarks and recommendations to help enhance workforce performance in medical practices.
Our practice is facing a major challenge. Turnover has increased to 40%, which is more than double the national healthcare average. This level of turnover impacts day-to-day operations and patient care becomes less consistent. Recruitment and onboarding costs escalate and staff morale declines. Effective management and leadership practices are essential to stabilize the workforce, reduce turnover, and build a more stable, supportive workplace. Replacing an employee can cost up to a full year of their salary, so reducing turnover has a big impact on our bottom line. Retention is important because consistent staffing supports continuity of care. When patients see the same providers, trust grows and outcomes improve. It also affects financial stability. High turnover as expenses such as recruiting, onboarding, and training all add up. Retaining staff helps protect margins. Retention impacts patient satisfaction as well. And practices with stable teams tend to score higher, which strengthens the reputation and even affects reimbursement. Finally, keeping staff reduces stress on the rest of the team. A stable workforce helps prevent burnout. One major cause of high turnover is burnout and poor work-life balance. Many physicians and staff report rising stress and low satisfaction, which contributes to turnover. Another factor is the clerical burden. Inefficient EHR systems and excessive documentation demands add to the burnout and reduces time with patients. And lastly, the limited growth opportunities and gaps in leadership support lead to disengagement, making staff more likely to leave and seek other positions.
Our retention model uses 5 evidence-based strategies to address why staff leave. First, burnout and clerical burden remain major drivers of turnover. Studies show that redistributing clerical tasks and optimizing the EHR significantly reduces strain. Second, compensation must stay competitive. NSI data show high turnover costs, which support investments in retention bonuses and pay adjustments. Third, clear career pathways and mentorship programs meaningfully reduce early career turnover. Fourth, targeted EHR optimization through templates and workflow redesign helps decrease documentation workload. Finally, engagement tools like stay interviews and pulse surveys ensure staff feel heard and supported. These strategies guide the interventions we plan to implement in Q1 and Q2. Leadership is one of the strongest predictors of staff retention. Transformational leadership has been shown to increase satisfaction and reduce burnout, which makes leadership development an evidence-based strategy for improving retention. Our proposed manager development plan includes a 6-month cohort-based leadership program that incorporates coaching and real-world action learning projects. We also recommend repeated communication and conflict resolution workshops and an internal certification for performance management. Managers will additionally receive training in EHR workflow optimization to help reduce documentation burden. Research shows multimodal programs, those that combine coaching, practice, and feedback, have the most meaningful impact on leadership behavior. NSI reports place national healthcare turnover at around 18%, and we will use this benchmark to set a realistic yet ambitious goal of reducing our turnover by 20 to 40% over the next 12 to 18 months. NSI also provides cost per turnover data that will help us calculate the financial return on investment of retention strategies. For monitoring, we will distinguish voluntary from involuntary turnover and break down data by the role, such as front desk, medical assistant, nursing, and billing, to identify where preventable losses occur. We will use pulse surveys and stay interviews to detect early intent to leave indicators. MGMA staffing metrics like vacancy days and time to fill will feed into retention dashboard updated weekly, monthly, and quarterly. This will allow leadership to quickly identify trends and measure impact.
The benchmark for measuring staff turnover is grounded in national and industry-level workforce data. Nationally, the average hospital RN turnover rate in 2024 was 18.3%, with many specialty units experiencing even higher rates. These figures provide a baseline for comparing our own turnover trends. We also look at generational benchmarks. For example, Gen Z healthcare workers report turnover rates as high as 38%, compared with 22% for millennials and 14% for Gen X. These benchmarks help us understand whether our turnover patterns align with national generational trends or signal unique internal challenges. In addition, regional workforce data offers another point of comparison. Some areas are seeing modest improvements in turnover and headcount, and these variations help us evaluate whether our own outcomes reflect broader regional patterns. Finally, we benchmark against best practice organizations. These include strong onboarding, mentorship, and flexible scheduling because these models consistently deliver lower turnover rates. Comparing our performance to these high-performing systems helps identify gaps and set realistic improvement targets. Building on these benchmarks, it's clear that improving retention requires intentional, evidence-based action. Following are high-impact steps we can take right away. First, embedding mentorship and peer support into our culture is one of the strongest predictors of retention. Structured support from day one helps new nurses transition smoothly, reduces burnout, and improves long-term satisfaction. We also need to prioritize workforce planning and flexible staffing. Flexibility is now a core expectation, especially among younger clinicians. Smarter scheduling and better alignment of staffing with demand improve retention and reduce reliance on costly contract labor. Employee engagement and recognition are just as important. Meaningful recognition and clear opportunities for growth make employees feel valued, and when people see a future here, they're more likely to stay. Finally, continuous feedback loops build trust. Regular surveys, listening sessions, and transparent follow-up show that staff voices lead to real change, strengthening loyalty and workplace culture. To identify success and measure improvement, we will track a set of workforce metrics that show both short-term progress and long-term stability. First, we'll monitor voluntary and involuntary turnover along with retention rates by role. This level of detail helps us identify where challenges are emerging and whether targeted interventions are working. We'll also evaluate recruiting efficiency through indicators such as time to fill, cost per hire, and vacancy rates. Improvements in these measures will show whether we're bringing new talent in more quickly and cost effectively. National workforce data will serve as a benchmark. By comparing our staffing levels, pipeline strength, and geographical distribution to broader trends, we can assess whether we're keeping pace with external demands. Employee engagement scores provide another crucial measure of success. Because disengaged employees are significantly more likely to leave, rising engagement levels and reduced early warning signals will indicate that our work environment is improving. Finally, we'll analyze the financial impact of turnover. Tracking both direct and indirect costs allows us to quantify the return on investment of our retention strategies.
We had the opportunity to interview Gloria Daly, practice administrator at Nova Pediatrics in Woodbridge in Springfield, Virginia, who shared her perspectives on employee turnover and practice culture. She described her own career path, moving from the front desk to billing and office management and ultimately administration, which shaped her understanding of staff development. Gloria emphasized the importance of investing in the person, not just the role, and explained that retention improves when staff feel they have a valued voice. She highlighted a small practice advantage, describing culture as a well rounded, functional family, echoing the supportive atmosphere her family experiences at VHC on the administration side of hospital delivery. She takes pride in mentoring staff and using word of mouth recruitment to nurture growth. For conflict resolution, she outlined a multi layered compliance approach involving HR, administration, and the practice's parent company as the final enforcement measure. On ethics, she noted that HIPAA violations can be learning opportunities, but stressed that breaches of trust and legality must be taken seriously. Her management perspective is that healthcare is ever changing, requiring leaders to learn, adapt, and give themselves grace. She concluded with a reminder that we're all in this together as a double edged sword, underscoring both the challenges and shared responsibility of practice culture. Reducing employee turnover in healthcare management requires a cohesive strategy that identifies root causes, strengthens leadership, and supports staff well being. Effective organizations assess workforce inefficiencies to later enhance managerial capacity while addressing occupational stress through targeted interventions. Progress is measured through key performance indicators such as engagement, retention, and patient outcomes. These long-term success factors depends on embedding proven practices across departments, making retention a sustained organizational priority. Implementing a comprehensive retention strategy yields measurable improvements across workforce, patient care, and financial performance. Workforce stability increases as turnover declines and staffing pipelines strengthen, contributing to greater organizational resilience. Patient satisfaction and safety improve through consistent staffing and support, which directly influence clinical outcomes and the overall care experience. Financial recovery follows, driven by reduced recruitment and training costs, alongside gains in productivity and operational efficiency. Over time, a culture rooted in engagement and stability fosters clinical excellence and positions the organization for sustained growth.